Bismillah. The muscle of the arm and cubital fossa. Some point you have to memorize regarding to the bone of the forearm. This is regarding to the radius and ulna. The radius, very important to know. This is the head. This is the neck of the radius. And this is what is called radial tubercle or radial tuberosity. Regarding to the ulna, this is the olecranon process. This is the coronoid process. And in between notch articulating with the trochlea of the humerus named trochlear notch. يبقى olecranon process, coronoid process, and trochlear notch. This is the regarding to the back of the elbow joint. This is the back of the elbow joint. Why this is the back? Because the olecranon fossa, and this is the olecranon process of the ulna. And in the humerus, olecranon fossa. The most common fracture here is the olecranon, and this is received the insertion for triceps. يبقى triceps inserted here in the olecranon. Very important. Regarding to the radius, this is the anterior view. This is the head of the radius. This is the neck of the radius. And this is the radial tubercle and tuberosity. This is received the insertion of what? Of the biceps. Biceps muscle. يبقى triceps inserted in the back in the olecranon, in the upper part of the olecranon, and the biceps in the radius in the radial tuberosity. Regarding to the coronoid process, this is received the insertion of brachialis. 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 يبقى olecranon triceps, radial tuberosity biceps, and the brachialis will be in a coronoid process. In the arm, we'll divide the muscle of the arm in anterior group and the posterior group. The anterior group of the arm or the forearm or the hand will be flexor, so the action will be flexion. And the posterior of the arm will be extensor muscle, so the action will be extension. How many muscle of the back of the anterior group? We have three muscle. Three muscle in the anterior group, اللي هو الفلexor group. The biceps brachii, brachialis, coracobrachialis. Biceps have two head, long and short. Brachialis means attached direct to the lower part of the humerus. And the coracobrachialis يعني from the coracoid to the humerus. So this is the flexor group anterior of the arm. And the three muscles supplied by the nerve from the lateral cord of the brachial plexus, musculocutaneous nerve. But the posterior group اللي هو extensor supply only have one muscle, triceps. Tri يعني have three heads, long, lateral, and medial head, and supplied by the nerve on the back of the humerus in the radial groove of the humerus named radial nerve. So the radial nerve هو الكنترول of the back of the arm, and the musculocutaneous هو الكنترول of the muscle of the anterior of the arm. Regarding to the coracobrachialis, and from the coracoid, from the name of this muscle is very short. If you wanted to see this muscle, go to the short head of the biceps, and you will see it behind it direct. اسمها coracobrachialis, from coracoid to the humerus, to the middle of the humerus. What is the nerve supply of this muscle? Musculocutaneous, because it is the anterior group. احنا قلنا اي anterior group يبقى flexion. Yes, flexion of what? This muscle acting on shoulder joint only. So will be flexion of the arm or flexion of the weak flexion of the shoulder joint. The second muscle originating, as we see here, from the lower half of the humerus and will be inserted in the coronoid process. So it is named brachialis. Nerve supply have double supply. Musculocutaneous, the medial part, and its a small lateral part supplied by radial. So have double supply. What is the action? Main flexion of the elbow. Initiate elbow flexion. So this muscle, very important, initiate flexion of the elbow. This muscle, this muscle acting on elbow joint only. Biceps, we have two head of the biceps. Uh, long, which is lateral, and short, which is medial. Both are originating from the scapula. Will be inserted in the radial tuberosity by biceps tendon and to the fascia by biceptal aponeurosis. يبقى التندون of the biceps in the radial tuberosity and by aponeurosis in the deep fascia of the forearm. So this is a short head. This is a long head, long head. Short head of the biceps. This is a short head of the biceps. This is the biceps muscle itself. This is a tendon and aponeurosis. What is the nerve supply of the biceps? Musculocutaneous from the lateral cord. Supply the three muscle, biceps, brachialis, and coracobrachialis. This muscle acting on elbow and shoulder. So flexion of the elbow, shoulder, and the powerful flexion of the elbow, and the most important action also, powerful supinator of elbow flexed or flexed elbow. Powerful supination of flexed elbow. What is the muscle behind the short head of the biceps? Coracobrachialis. So this is regarding to the action if you wanted to assess this muscle by biceps reflex. So please, could you make a short story about musculocutaneous nerve? The musculocutaneous from the lateral cord of brachial plexus. So the lateral cord originating from C5 and C6 and C7. This muscle, this nerve supply three muscle, biceps and brachialis and coracobrachialis. So this nerve is very important, piercing the coracobrachialis, which muscle pierced by musculocutaneous will be coracobrachialis. After that, you can see this nerve between the biceps and the brachialis, between the biceps and the brachialis. Then will continue in the lateral side of the forearm and supply the skin of the lateral side of the forearm. So it is named here cutaneous. So will continue in the forearm as lateral cutaneous nerve of forearm. So what is the origin of the lateral cutaneous nerve of the forearm from musculocutaneous? So this nerve supply three muscle and supply the skin lateral side of the skin of the forearm. You can testing the muscle by what is called biceps reflex. Just tapping your thumb of the physician by a hammer and will produce involuntary contraction of the biceps. This means integrity of the nerve. The positive response means the nerve is intact. اللي هو musculocutaneous nerve. The triceps, we have three heads from triceps. Three heads from triceps. We have long head, which from the scapula, and the lateral head and the medial head from the humerus. This is the long head, which is medial. Lateral head is lateral, and the medial head in the lower part. Both the triceps will be inserted. The most important bone on the back of the elbow, olecranon process. So any fracture of the olecranon process will be inserted in the olecranon process, triceps. What is the nerve supply? طبعا the radial nerve here between the medial head and the lateral head of triceps. between 2 and 3. So this is a radial nerve, so supplied by radial nerve. The main action of this muscle, extension of the elbow. Main extension of elbow. This is regarding to the heads. Number one, long head. Number two, lateral head. And four, this is a nerve in between the heads named radial nerve. Finally, what about the cubital fossa? Cubital fossa, it is a depression in front of the elbow, like a triangular in shape, have a boundaries and the content. What are the boundaries of the cubital fossa? Please go to the medial epicondyle, which is a prominent bone of the humerus. This is the medial epicondyle. And on other side will be the lateral epicondyle. Please connecting to this by a line. This line will be a measure line between the two epicondyles. So we're making now one border of the triangle. From the medial epicondyle, go by an oblique muscle laterally. This muscle named pronator teres. And this is the second border. So the base will be the imaginary line between the two epicondyle and medially by pronator teres. And the third border of the triangle will be brachioradialis. Brachioradialis. Again, this is the shape of the triangle. ها يبقى البيز اللي هو الميديال between the two epicondyle, and this is the pronator teres, and this is the brachioradialis. We cover by this fossa by a roof. Roof يعني skin and fascia. This skin containing a veins as we see here, three veins, cephalic or cephalic vein, basilic, and in between number three will be cubital vein or median cubital vein, and this vein is very important, is named the vein of injection. What are the content of the fossa? If you wanted to see the content of the fossa, as we see here, nerve, artery, tendon, and nerve. From medial to lateral. From medial, the most medial nerve you will see median nerve. After that, we'll see artery, brachial artery. And here biceps tendon, and finally you will see the radial nerve. So all are the content of the cubital fossa: nerve, artery, tendon, and nerve. Nerve median, artery brachial, and tendon of biceps, and finally the radial nerve will be the lateral content of the cubital fossa. What is the nerve medially in the fossa? Will be median. What is the nerve laterally in the fossa? Will be radial. Which artery content inside the fossa? Brachial artery. And which tendon of muscle inside will be biceps tendon. Very important clinically for taking a sample of the blood or blood donation, and also measuring of the blood pressure by hearing the sound of the brachial artery. Thank you so much.